Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right 6 and 7 for implant placement. This is the panoramic view. We can see an edentulous space in the upper right 6 and a broken down endodontically treated root in the upper right 7. Now on the transaxial view, which is the proximal view, this is the transaxial view. I'm going to zoom in for our kind doctor. The transaxial view, we can clearly see we've got a ridge. We've got a slight bit of a buccal depression here, but the overall ridge quality is D3 of bone. We've got at the crest of the ridge, we've got approximately 6.4 millimeters of ridge width and approximately 11 millimeters of ridge height, just inferior to the sinus. Now, the implant placement will have to be done slightly palatally, the angulation as well as the placement, because the doctor does not want to perforate the buccal cortical plate because of this depression here. Moving to the upper right second molar. The upper right second molar is a broken down BTR. The ridge quality and the ridge width here is 11.6 mm and the ridge height is approximately 13.5 millimeters. An immediate implant placement will definitely be possible because there is interradicular bone in this region, which can be utilized for engagement. However, a two-stage surgery where extraction and bone grafting will yield better results in this case. We do not have the exact Turkish brand of the implant, but we will place a generic implant and will also share the implant planning report. So a better understanding of this area can be done by our kind doctor. Now, to place the implants, I'm going to move on to the 3D rendering. First, the implants here you can clearly see the first and the second implant. The first implant is going to be a 4.1 10 millimeter implant in the region of the 6, and the second implant is going to be a 4.1 11.5 millimeter implant. Now a millimeter higher and a millimeter lower and slightly narrower implants can also be done, but this is the ideal a 4 to 4.3 to 4.1 millimeter diameter and approximately 10 to 11.5 millimeter in height implants can be placed in this region. Now on the axial view, we can see that the implants are placed right in the center here. The implants are going to be extremely helpful in this region if placed in the center because they will have good bone support 360 degrees all around, so that the osseointegration can be very well accepted. Now this is the implant on the transaxial view. On the transaxial view, my apologies. On the transaxial view, you can clearly see that the implant is going to be placed in the center and will need to be grafted around. This is the implant in the upper right 6 region, which is placed right in the center, avoiding the buccal depression here and with long-term stability for our patient. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.